Drugs are classified into categories based on their safety for use during pregnancy, primarily by the FDA. Here are the classifications. 1. Category A. Adequate and well-controlled studies have failed to demonstrate a risk to the fetus in the first trimester, and there is no evidence of risk in later trimesters. Example, folic acid, levothyroxine. 2. Category B. Animal reproduction studies have failed to demonstrate a risk to the fetus, and there are no adequate and well-controlled studies in pregnant women. Example, amoxicillin, metformin. 3. Category C. Animal reproduction studies have shown an adverse effect on the fetus, but there are no adequate and well-controlled studies in humans. However, the potential benefits may warrant use of the drug in pregnant women despite potential risks. Example, tramadol, gabapentin. 4. Category D. There is positive evidence of human fetal risk based on adverse reaction data, but potential benefits may warrant use of the drug in pregnant women despite potential risks. Example, valproic acid, lithium. 5. Category X. Studies in animals or humans have demonstrated fetal abnormalities, and the risks involved in using the drug in pregnant women clearly outweigh potential benefits. These drugs should not be used in pregnancy. Example, isotretinoin, warfarin. These categories were phased out in 2015 by the FDA in favor of the Pregnancy and Lactation Labeling Rule, PLLR, which provides more detailed information on risks and benefits. However, many medical professionals and resources still reference these categories for guidance. Disease-modifying anti-rheumatic drugs, DMARDs, are important for managing autoimmune diseases like rheumatoid arthritis, but their use during pregnancy must be carefully considered due to potential risks to the fetus. Here's a summary of the safety profiles of common DMARDs during pregnancy. Safe DMARDs during pregnancy. Hydroxychloroquine, HCQ. Safety, generally considered safe. Use, widely used in systemic lupus erythematosus, SLE, and rheumatoid arthritis. Notes: no increased risk of fetal malformations, can be continued throughout pregnancy. Sulfasalazine, safety, considered relatively safe. Use, often used in rheumatoid arthritis and inflammatory bowel disease. Notes: should be supplemented with folic acid at least 2 milligrams per day, as sulfasalazine interferes with folate metabolism. 2. DMARDs to use with caution. Azathioprine, safety, can be used during pregnancy if benefits outweigh risks. Use, used in SLE, inflammatory bowel disease, and other autoimmune conditions. Notes: no significant increase in congenital abnormalities. Dose should be kept below 2 milligram kilogram day. Corticosteroids, low to moderate doses. Safety, considered relatively safe, though higher doses are associated with increased risks of gestational diabetes and preterm birth. Use, often used to manage flare-ups during pregnancy. Notes: prednisone is preferred as it has limited placental transfer compared to other corticosteroids. 3. DMARDs not recommended or contraindicated during pregnancy. Methotrexate, MTX, safety, contraindicated in pregnancy. Use, commonly used in rheumatoid arthritis and psoriatic arthritis. Notes: it is highly teratogenic and can cause miscarriage and congenital abnormalities. Must be discontinued at least 3 months before conception. Leflunomide, safety, contraindicated in pregnancy. Use, used in rheumatoid arthritis. Notes: teratogenic, requires a cholestyramine washout procedure before conception if the drug was taken within the previous 2 years. Mycophenolate mofetil, safety, contraindicated in pregnancy. Used in lupus nephritis and other autoimmune diseases. Notes: strongly teratogenic, linked to high rates of miscarriage and congenital malformations. 4. Biologics, TNF inhibitors, e.g. adalimumab, etanercept, certolizumab. Safety: certolizumab is preferred due to minimal placental transfer, especially in the 3rd trimester. Other TNF inhibitors are generally considered safe in the first 2 trimesters, but should be stopped later in pregnancy. Use, common in rheumatoid arthritis, ankylosing spondylitis, and other autoimmune diseases. Notes: newborns should not receive live vaccines for the first 6 months if the mother was on TNF inhibitors late in pregnancy. Rituximab, safety, avoid unless necessary. Use, used in conditions like lupus and vasculitis. Notes: data on pregnancy safety is limited, and potential risks include fetal B cell depletion. Abatacept, tocilizumab, and other biologics. Safety: limited data on use during pregnancy, generally avoided. Use: used in rheumatoid arthritis and other autoimmune diseases. Notes: should be discontinued prior to conception and during pregnancy unless absolutely necessary. General considerations: always weigh the risk to benefit ratio when managing pregnant patients with autoimmune conditions. Pre-pregnancy counseling is essential to adjust medications before conception. Regular monitoring of disease activity and fetal health is critical throughout pregnancy. Would you like more details on any specific drug? Here is a list of DMARDs and their corresponding pregnancy categories. Safe or generally considered safe. 1. Hydroxychloroquine, category C. 2. Sulfasalazine, category B. Used with caution. 1. Azathioprine, category D. 2. Corticosteroids, e.g. prednisone, category C. Contraindicated or not recommended. 1. Methotrexate, category X. 2. Leflunomide, category X. 3. Mycophenolate mofetil, category DX. 1. Adalimumab, category B. 2. Etanercept, category B. 3. Certolizumab, category B. 4. Rituximab, category C. Let me know if you need further clarification or more DMARDs added to the list. Here's a more complete list of commonly used DMARDs and their pregnancy categories. Conventional DMARDs. 1. Hydroxychloroquine, category C. 2. Sulfasalazine, category B. 3. Methotrexate, category X. 4. Leflunomide, category X. 5. Azathioprine, category D. 6. Corticosteroids, e.g. prednisone, category C. 7. Mycophenolate mofetil, category DX. 8. Cyclosporin, category C. 9. Tacrolimus, category C. Biologic DMARDs, TNF inhibitors. 1. Adalimumab, category B. 2. Etanercept, category B. 3. Certolizumab, category B. 4. Non-TNF biologics. 1. Rituximab, category C. 2. Tocilizumab, category C. 3. Abatacept, category 4. Anakinra, category B. 5. Secukinumab, category B. Targeted synthetic DMARDs. 1. Tofacitinib, category C. 2. Baricitinib, category C. 3. Upadacitinib, category C. This list includes the most commonly used conventional DMARDs, biologics, and targeted synthetic DMARDs with their FDA pregnancy categories.